Hey, I'm Dr. Taylor Welbeck with Welbeck Chiropractic, and today we're going to talk about what to expect on your first visit at one of our offices. Now, for any new patient who comes into our office, we want to make sure that we take as much time as needed to really figure out what your problems are. And so what that means, the very first thing that you're going to do is you're going to sit down with one of our highly trained doctors, and they're going to do a consultation with you. They're going to sit down and ask very detailed and specific questions about what problem or problems you are experiencing. We'll ask things like, when did the problem start? What caused it? We'll ask, how long has the problem been ailing you? We'll ask things like, how intense is the pain? What makes the pain feel better? What makes the pain feel worse? All of those questions give us really important information that help us form an accurate diagnosis of the problem. And at the end of that consultation, we'll let you know if we feel that you're a great candidate for chiropractic care. If you're a great candidate, we'll let you know. If for whatever reason, in the off chance that we feel your condition may not be a chiropractic problem, we will let you know that as well, and we'll give you a referral to go someplace that can help. Luckily, most musculoskeletal problems that come into our office can be helped with chiropractic. And so after that consultation, one of the doctors will then perform a thorough orthopedic and neurological examination where they're going to do a full spine assessment. They're going to check the alignment of your spine. They're going to check how your muscles are doing. We'll do things called orthopedic tests, which give us a more detailed and accurate idea as far as what is causing your pain or really what the underlying issue is. And then at the end of that examination, a lot of times we like to take x-rays of the problem. Now that is not every single patient, but a lot of the times we'll take x-rays because that gives us a confirmation about what we found in the examination. That gives us a good status update of your spine and kind of lets us know the extent of the injuries that you may have. And generally after the x-rays, that really wraps up the first day. That gives us a lot of information to sift through. And so after that first day, our doctors will sit down, we'll look over the results of the examination, we'll look over the x-rays, and we're going to formulate what our diagnosis is, as well as what your individual treatment plan or what our recommendation of care to you is going to be to fix that problem. Generally, we're available and ready by as soon as the next day to go over all of that with you. So we typically have the patient come back the very next day, and on that visit, we sit down with you. We spend a good 20 or 30 minutes with you going over the results of the x-rays. We go over the results of what we found in the exam. We let you know how chiropractic care can help, and as well as what is the extent of the treatment needed to fix your problem. Again, everybody's different. We won't know exactly how much treatment you need until one of our doctors does the consultation, does the exam, and if necessary, takes the x-rays. And so on that second day, that's typically when we perform your first chiropractic adjustment. And then one of our billing specialists will sit down with you and they'll let you know how your insurance will play. If you don't have insurance, we have a ton of different self-pay options. About 50% of our patients don't have insurance. So we have a lot of different options available for those patients as well. And so we just want to provide as many options as possible to make it as budget friendly as possible. And so after that, we'll then put together your schedule with what the doctor recommended. And at that point, you'll be considered an established patient.